I'm just waiting for Chairman Dr. Venkat Ramana, who will be here in a few moments. In the meanwhile, I'd like to call upon stage our two chairpersons, Dr. Vinay Gupta, who is an andrologist and sex counselor, also a microsurgeon from NSVT surgeon at Bilaspur. So Bilaspur is Jharkhand, Chhattisgarh. Raipur, Bilaspur, yes. Sir, please come on the stage. And we also have the other chairperson, Dr. Dinesh Mahajan. Please. Yes, sir. Dr. Dinesh Mahajan, founder director of Abhigaman Sexual Health Clinic in Nasik, and I hand over charge for the beginning of the session to Dr. Venkat Ramana, sir.
All the speakers and chairpersons.
Three speakers, very interesting topics. Dr. Thareja from Melbourne. He will speak on intrapenile injection practical approach. Second speaker will be Dr. Satyanarayan Reddy from Hyderabad. He is going to speak on cancer causing erectile dysfunction. And third speaker will be Dr. Colonel V.K. Wadia, who is going to give his talk on LGBT movements. So, without spending much time, I will call Dr. Thareja to come and give his talk on this intrapenile injection. Dr. Thareja is MBBS, FCGP, Consultant Sexual Medicine, Thareja Nursing Home, Melbourne, Honorary Professor IMA, FCGP, Joint Secretary, Finance IMA, Ex-President IMA Rajasthan, President International Association of Sexual Medicines Practitioner 2020 and 2025, Vice President of Council for Sex Education and Parenthood International from 2017 to 2023. Now, masterpiece of training in intracavernosal injection of vasoactive ducts. He is received various awards. Silver Lamp Award CSEPI 2014. I am a National President's Appreciation Award in 2019 and Golden Lamp Award, the highest honor of CSEPI in 2022. I should congratulate Dr. Thareja, who is the only person who is emphasizing about intrapenile injections. He is not only giving information these days, because intrapenile injections usually drugs used most effective is chlorpromazine, which is not available. So I am thankful he is making available this chlorpromazine injection to the surgeon who are using intrapenile drugs. And no doubt, in the practice of sexual medicine, the importance of intrapenile is very, very important. We usually do. I am also using intrapenile injection since last 20 years, and we use this injection as pipe test. This is more effective, more realistic as compared to colored Doppler if it is done properly. So now I request Dr. Thareja to give his talk.
Tell you more of the theory. If you are interested, I can tell you the theory in detail. But my theme is to hands-on training to all of the persons, because intracaverous injections are very much important. In our sexual practice, the much more important thing most of the doctors miss, that is to take the sexual history. And sexual history is always to be taken by 1:1. It is never taken 1:2. If we take 1:2, then history will become the mystery. Then comes the physical examination of the patient, private parts and all the physical examination. Then comes the investigations. Then comes the counseling, and last comes the pharmacotherapy. Because in our conference, I have seen the way and the delegates come, he tell, Dr. Saab, please tell me the pharmacotherapy, I will do it. Only pharmacotherapy will not act at all. But counseling and pharmacotherapy will work with proper history, investigation and counseling. Now I want to tell you how to prepare bimix, trimix, And what are the intravenous injection available in India? In India, that is Pepaverine is available. Pepaverine is given intravenously. The dose is 15 milligram. Detailed history I will tell you in the, and we can give up to the 80 milligram. One ampule contains 60 milligram of Pepaverine. Initial dose is 15 milligram. With Pepaverine, you can get the false results. False results are not sure. That can be done afterwards with the Bimix, Trimix and PG1. Bimix is a combination of chlorpromazine and Pepaverine, and Trimix is a combination of chlorpromazine, Pepaverine and PG1. And PG1 is alone PG1. PG1 is available in one ampule of the ampule, and that contains 500 microgram of PG1. Now, if you want that it should be prepared, how to prepare Bimix, any volunteer can come, and any 2 or 3 volunteer can come. They can show you. I will direct them. They will do with their own hands and show you all the person. Any 3 volunteers can come. Most welcome. Any. First of all, as everybody has read the pharmacology. In our pharmacology, it has been very well understood what are the drug which is minimum in quantity should be given first, and which is second, which is more is given afterwards, and the maximum that is given at the last. So the minimum quantity is of chlorpromazine, that is 0.5 ml. Any volunteer can take the chlorpromazine. Chlorpromazine is to be taken with the tuberculin. Please leave some space so that the rest of the person can see. You take 0.5 ml of the injection. 0.5 ml. 0.5 ml with tuberculin syringe so that the accuracy will be maintained. 0.5 ml. You can make it no 20 units, 50 units. This is tuberculin syringe. It has got 100. Put in empty autoclave glass. Put 0.5 ml in it. Then take the injection PG1, 1 ml, just I will give. This is the PG1. 1 ml is to be taken with this 2 ml of the syringe. Put it here, don't throw it. Otherwise it is a biomedical waste. At last we will. चाबी थी अभी एक मिनट देना इनको चाबी ले लो एक मिनट दे दो चाबी के बाद में ले लेंगे भैया इनकी कार मत ले जाना आप इनकी माय रिक्वेस्ट बोल नहीं सकते you take 1 ml out of it this PG1 this 1 ml injection. If you are interested in theory, I can tell you theory afterwards. PG1, young man, you can read it. MRP. You can read it. And put it in the shaking like this, so that it will mix it properly. But डाल के शेक करना नीचे नीचे बैठ करके आपको धीरे धीरे शेक करते रहो शेक करते रहो ठीक. Now we have taken this is chlorpromazine 0.5 ml and PG1 1 ml. Now take 19.5 ml of injection Pepaverine. Where is the case? Because you can see the rate and company and that they can. Yeah. This is 2 ml. You have to. हाँ, 10 तोड़ने पड़ेंगे भाई. You have to do some practice. You can manage, can do it. You can take 20, you can take 10 ml of the syringe. Here is 10 ml of syringe. With 10 ml of syringe, there is nothing I said. You have to take 19.5 ml of injection paper. You count it, Amit, you. And do it in the like shaking manner so that it will be mixed properly. 19.5. You want some help? You want help? Each ml contains 30 milligram of papaverine, and it is 2 ml ampule that contains 60 milligram of papaverine. You can take the photograph of which company it is. 19.5. 19.5.
I will request everybody to take the seats. Thareja, you can.
Please take the seats. You request that person.
20 ml Penile.
Please, there is one slide. One slide is there.
Slide 2 ml.
Anyone is there? Last but one slide. Last but one slide. Last but one.
Second last slide लिखाने
The second last slide. Yes, this is still there. Yes, yes, this is the privacy letter. You can take the photo or you can, you have to give to the patient. Privacy letter.
अरे बाबा लगा लगा
Please,
ठहर एक मिनट
you take the photograph. He's sharp in that.
यस
कम हो तो और भी ले लो इसमें.
हो गया ना उसका नाइट
Excuse me, sir. Give me some
Please take
space
the
to
seat.
photographer.
We have to follow the chairperson.
यस सर
We have to follow the chairperson. Now the much more important thing, how to give injection. That is much more important. After that, how to
उसका हम
treat the
करके बैठ
apparatus. Please take the seat. Please take the seat.
हाँ बंद कर.
हाँ जरूर. अभी पहले बना रहे हैं. इन्होंने अपने हाथ से बनाए हैं.
Listen, doctor.
Trimix. He himself has prepared.
Excuse me, sir. थोड़ा सा
Okay. Now Trimix is ready. If we want to make prepare bindings, don't add PG1. That becomes yes. Inject it. And feel the resistance. If there is a resistance, then don't push it. Take it out. Or only one. Either 2 or 10. Gone. Done. Now it is done. And we have to wait for 5 to 10 minutes and we have to massage it gently and watch this for 30 minutes. Watch this 30 minutes, it will erection will come. If we want, sometimes we get the patients of unconsummated marriage or before marriage patient comes to us, say, Doctor साहब please बताओ मैं शादी के बाद कामयाब हूँ कि नहीं. तो So then we used to do intracaverous injection with penile sonography. First of all, we will do the sonography in flaccid stage. Then we get this injection done, and then we do this sonography for 5 minutes, 10 minutes, 20 minutes, and every 10 minutes we do the sonography. So we see the peak systolic velocity, end diastolic velocity, and rigidity index. If normal peak systolic velocity is 30 per centimeter, end diastolic velocity is 3, and rigidity index is normal is 0.9, then this remain erect. Then we have to see within 3 or 4 hours it becomes flaccid. If it does not become flaccid, then it is a challenging job for a sexologist. That is very difficult, and you don't lose your mind temperament. Reach here, give him diluted injection adrenaline or injection phenylephrine, and give 0.5 ml of injection, same site, and do. In my practice, people don't advise the cold sponging. I practically use injection phenylephrine or adrenaline with cold sponging. Then it becomes flaccid easily, and if it does not become flaccid, then we can repeat. We take 21 gauge of scalpel needle, put it at the 10 o'clock position and 2 o'clock position, till allow the blood to come. If we will see the penis become flaccid. If it does not become flaccid, we have to take out the blood till the red blood comes. Then, if it is even does not flaccid, then we have to repeat the dose of diluted adrenaline or phenylephrine. And if nowadays we are not giving home self injection to the patient, previously we are giving home self injection. Now this PDE5 inhibitor and so many things has came in the market. Along with that, there is excellent results. Any question is most welcome, because I am told by the chairperson to finish it.
So what should be the injection? 26 gauge needle? Needle 26 gauge.
21 injection.
31 injection.
Injection is 30 gauge needle, insulin needle.
Okay.
Right, 31 sir, away. Nowadays 31 is the thinnest possible, which is
And so the entire depth, the entire length should go.
And that is a ½ inch long.
Okay, so that much should go inside.
If you are interested, you can see this one.
Correct.
Insulin needle.
Thank you, thank you.
Any questions?
Good.
And one more thing, sir.
Thank you, Dr. Thareja.
PDE5 inhibitors have some limitations. Those clients who are not helped by PDE5 inhibitors, even in the highest dose or even in double dose, there are many patients you will see those who have taken 2 tablets of 100 milligram of sildenafil or 2 to 3 tablets of tadalafil 20 milligram and not helped. Those are the cases where home self injection is the remedy for them. So
Sir,
without worry, you can give, sir.
Before giving the home self injection, we should be cautious. The patient should not be very anxious. If he is very anxious, he will repeat the dose within 24 hours.
Those are the vascular cases which invariably will not develop priapism at all.
If we develop the priapism, we have to select the patient for the home self injection. We should not give the psychotic patient. We should not give the patient with the protuberant abdomen. We should not give to the patient who has got this blood dysplasia. We should not give the patient who have got a sickle cell anemia. We should not give to the patient whose ECG is abnormal. So that if ECG is abnormal, we cannot give an injection adrenaline to them or phenylephrine to them.
Okay, now we don't have time. Please, you can discuss in outside. No problem. Thank you, Dr. Thareja. Although this intrapenile injection is a very vast topic, it requires at least 2 hours of workshop to learn how it is to be given and how to manage priapism, whom to give, how to give. So in next conference, we would like to have this workshop on this